Hey guys, it's January 28th. I wanted to make another little update about my nursing school process. I guess we're already into our third week here, so I thought I would just give a little update about what that's been like. First, I just wanted to give a little disclaimer to all of my subscribers who have been following me for a long time. I think I've been making videos on YouTube for 6 years. So a lot of people have been following me for a long time. If my nursing topics really uninterest you, I certainly apologize. I'll try to indicate in the title of each video if it's nursing related, and then if that's so boring to you that you can't stand it, then just ignore those ones. But to everybody else who's found me through other ways, hopefully this will be kind of interesting and maybe provide some information for you. Anyway, so that was my disclaimer. It's been a busy 2-3 weeks so far. We did all of our orientation stuff, which I made a video about that before, and then it's kind of been full blast since we started. We're in class, or we have things going on 4 or 5 days a week, so pretty much every day we're doing something, and it's been really good. I really like my professors. I think I'm developing my flow, my routine, but it's been busy but really good. We've had several lectures on different topics, and then we've been working in the lab. They're trying to push a lot of skills at us really quickly here in the beginning, so that for the first part of the semester they're really, it's very skill intensive and doing a lot of checkoffs, so that at least in the second half of the semester we're able to do all of them in the clinical setting. So, and then we do have clinicals as well. So it's been good but busy. I think our first week we had 3 tests in a way. Every semester we have to take they used to call them dosage calculation exams from like pharmacology. Now they call them medication administration exams, which is probably more accurate. But we had to, right in the beginning, like the second day of class, we had to take a dosage exam to make sure that we can accurately calculate medications for administration. You could only miss one question on that, or you had to retake it, and then I think if you fail it or miss more than one question the second time, you're out of the program. So they're pretty serious, but it was not difficult. When I took pharmacology, we had much more difficult topics, so this was a little bit easier, but we have to take one of those at the beginning of each semester, so we did that. Then, like I said, we have to take, before starting the program, we have to take a basic nursing skills class where they teach a lot of mainly sort of nursing assistant type tasks. So we had to take a mastery checkoff on that and make sure that we were able to perform all of the skills that we learned in that class. That was actually quite easy, but if you don't pass that, you're kind of in trouble. I think the policy for all of our skills checkoffs is that you can fail a checkoff once, and then you have to retake it with another monitor. If you fail it the second time, you're just out of the program. You have to reapply and I don't know if you have to reapply, but you at least have to take the whole semester over again. So you can't mess up those skills checkoffs. So we did that one, and then our first week we had a gigantic 8-hour physical assessment lecture, which was kind of introduction to everything you need to know about the initial, physical assessments. And then we had a little bit of time to practice it, and then we were checked off on those as well. So those, luckily, all of those initial tests went well for me. So that was kind of out of the way. And then since then, we're just getting more lectures, more lab time, and we did our orientation to our clinicals last week. So we've been doing in lab, I guess we've been doing a lot of medication administration stuff. We studied first oral medications, and then we did all the injectable medications. In my program, we don't do anything IV until the second semester. So, but everything that's not an IV med we have already studied, and we're about to be checked off on it here on Thursday, I think. So we got a big box full of needles and syringes and stuff to practice injections, and we'll be checked off on that here in a couple of days. But it's been pretty fast. Although I have to say, so far nothing seems too difficult. It's been a lot of information coming really quickly from many different directions, but nothing seems too difficult. It doesn't feel overwhelming yet. It's just more a question of prioritizing. Am I focused on studying lecture information or practicing lab skills, or there's a lot of clinical homework, all of that. So it's more of a time management thing, but so far everything is manageable. Also very interesting because I think it took me 2 semesters to do all of my nursing prerequisites, and then I did 3 more semesters in general education and bachelor's prerequisites, which were completely unrelated to nursing or anything that I'm really interested in. So some classes were moderately interesting, some of them were not. So it's nice to be back focused on what I'm actually interested in now. So every day something interesting is happening. Today we had a really interesting lecture on the nursing process. It was one part of the nursing process where we look at all of the information from the charts and the patient history and the physical assessment and all that kind of stuff, and then we start to put together our nursing care plans and stuff like that. So it's kind of an important topic, so that was very interesting. And then tomorrow we have a simulation lab on medication administration, and then a clinical day. Tomorrow, Wednesday, will be our first real clinical day. So every day is something interesting that I'm excited for. So that feels really good. My clinical site is really cool, and I really like my clinical instructor. She's one of the classroom instructors. They all took a group of students. So the one who is my clinical instructor, I really like her, and I like our facility. It's a neuro rehab facility. Some people are going to hospitals. We are actually at a neuro rehab hospital. And initially I thought, well, I'd rather be in an acute setting than a rehab setting. But it's really not. It's more focused on the neuro part than the rehab. Well, obviously it's a rehab hospital, but it's everything related to neuro. And they've got sort of 5 different units there based on acuity, and we'll rotate through each of the units throughout this semester. So although it's a rehab hospital, we have really acute patients who've got chronic long-term issues, and many of them won't recover from these injuries and are really facing a lot of complications. So I think we'll see a lot of things there. I've worked with some people who have rotated there as students, and they said they loved it. One of my colleagues at work said that was her favorite rotation of all. So I think it'll be really fun. I'm really excited. I work in a very nice hospital as a nursing assistant, and it's very modern and kind of state-of-the-art, and all of our charting is electronic. There's no paperwork involved. Really, virtually none at all anymore. We've been transitioning, I guess, for longer than I've been there, but it's electronic. This neuro rehab place is not. It's very, very old. Everything is paper-based. There's no computers in sight. It's very it feels like it might be a history lesson in how nursing worked in the past, which will be interesting, and I'll be learning how to do a lot of charting and documentation in a way that I've never seen before, but I don't know how useful that is, since everybody's moving towards electronic charting if they're not already there. So learning how to do it the old-fashioned way is not really a useful skill, I suppose, but I guess it forces us to slow down and make sure things are accurate. So very excited for that. So that's about it. Like I said, it's been busy but manageable so far. We have a checkoff in med administration this week, and then an exam as well, and then clinicals and all of that kind of stuff. So very exciting. I will update periodically on my school, not every day or every week or anything like that, but periodically I'll keep you guys updated. If anyone has any questions about what I'm doing or anything else, let me know. Send a thing in the comments and I'll respond. And that's it. So far so good. 2 weeks down. What did I calculate? Something like 64 weeks of nursing school classes is what it will take before I graduate. So 2 weeks down, 62 to go. Take care, guys. I will talk to you soon. Bye.